It's now time for Motivational Mondays with Fionia Salmon.
Hi, everyone. Welcome back to another episode of Motivational Mondays. I am your host, Fionia Salmon. A warm welcome to viewers on Facebook and YouTube Live. Thank you so much for tuning in. Today, we are here to shed light on a topic that has the power to save lives: prostate cancer screening. This is an area where many men delayed action, often due to fear, pride, or lack of awareness. Today, we are honored to join by a survivor, that's Mr. Michael Jureidini, and also Miss Shullian Brown, a representative from the Cancer Society. Today, they're here to share. Mr. Michael will be sharing his experience, what it's like, how long is the procedure, what were some of the symptoms that he experienced, and a lot more to come. And also, Miss Brown will be sharing about why it's important to get screening. But before we tap into our discussion, I want you to say thank you so much. Motivational Mondays is sponsored by Ionia Distributors LLC, the company that distributes my stainless steel barware sets, my motivational t-shirts, mug, pens, and also it featured the title of my book, It Will Be Long, But Not Forever. Thank you so much for your support. Thank you for everyone who purchased a book or pen or a tote bag. I really appreciate you. Thank you so much. And if you haven't subscribed to my YouTube channel, what are you waiting on? Go ahead, subscribe to Fionia and Friends. And for those of you who already subscribed, thank you so much. Thank you, and continue to share my content wide and far. So let's get into the discussion. Miss Brown, it's a pleasure to have you here on Motivational Mondays. How are you doing?
I'm fine. Thank you for having me.
You're most
My
welcome.
pleasure to be here.
You're most welcome. Just give us a little background about yourself and how many years have you been working with the Jamaica Cancer Society?
Sure. I am the Public Relations and Fundraising Officer at the Jamaica Cancer Society. I've been doing that for the last 18 years. And prostate cancer and raising the awareness about prostate cancer is very important to me because I have several family members on
Wow.
my father's side who are prostate cancer survivors. And so I always tend to try and up every year's activities just to ensure that our men have access to screening.
Oh, that's wonderful. And thank you so much. And further down, we will be asking you about your initiatives. And Mr. Michael, thank you so much for being here. How are you doing?
And thank you. Giving that
And
time.
yes, you're most welcome. And you are a prostate cancer survivor. How many years since you've been surviving?
Actually, I celebrate, and I say it without reservation, celebrate
Uh,
15 years later this week.
wow.
Yeah,
Wow, 15 years?
yep, 15 years.
Oh my God, that is so wonderful. I can't wait to get back into the process of staying cancer free. But Miss Brown, tell us why is important for men, especially is it men over 40, to make sure that they get screened?
Okay, so prostate cancer is a cancer that affects primarily men. Only men, black men are more tending to get this cancer. It's more aggressive in our black men. And unfortunately, I don't know if it's a matter of race or men tend to present with prostate cancer at a later stage. And as a result of that, the disease is more debilitating for them, and we lose a lot of our men due to late stage diagnosis. The key to prostate cancer is that it's a slow growing disease. So once
Yes.
detected early, it provides and lends itself to treatment and to, for many men, a cure. Or the fact of the matter is that it allows more men to spend more time with their families once the cancer is detected earlier. The difficulty is in getting the men to get screened and
That's
getting the men to understand this simple little thing takes less than 30 seconds or a minute for screening because the doctor just wants to use their index finger, which is what we call the digit, or the digit rectal examination is one of the ways through which prostate cancer is screened for. And to examine the prostate through the rectum, because it's very close to access the prostate from there. And they just want to feel if the prostate is smooth, or if the prostate is enlarged, or is there any ridges or grooves or lumps on the prostate that will indicate that there's something going on there? And that's what it's about. The prostate is supposed to be as smooth as the tip of your nose. And if the doctor inserts his or her finger and the prostate is rough, there's ridges, there's grooves, there's lumps. If the finger can't go all the way around, the prostate is enlarged, then there are issues there that need attention.
Thank you so much. I know that some men will definitely feel uncomfortable or have that tension towards that examination process. But is there another method that can be done to detect prostate cancer or to test the prostate?
Okay, so the prostate screening involves two tests: the digital rectal exam and also the prostate specific antigen or PSA blood test. And what that wants to find out is the amount of prostate specific antigen that is in the blood. And that will indicate if there's an increasing number, anything up to 10 and over, that would indicate that there's something going on with the prostate. And anything below that would indicate that the prostate is normal. However, this is not sufficient. It's not alone. Because remember, I said that the doctor is saying your prostate is supposed to be as smooth as the tip of your nose, right? So how is it that the doctor is going to examine and find that out?
That's
The
right.
digital rectal exam. Because a man who is 40 and is of African descent is at great risk of catching or getting rather prostate cancer, being diagnosed with the disease, yes?
Wow.
And then there's the persons whose family member was diagnosed at the age of 40 or 45 with prostate cancer. Even what we say is you start your screening 5 years earlier than the age of the person in your family that was last diagnosed with the disease. So if you are 45, excuse me, and your father, grandfather, or uncle was diagnosed at the age of 50, if you haven't started screening yet, now is your time to shine at 40.
That's right.
Right? If you are 40, start screening as well. And it's just a simple process. And I say simple, I don't have a prostate and I understand the anxiety. But we have been doing this and offering as a Cancer Society free screening to men for a number of years now. Up to Friday, we were in Monday for screening. And we did over 100 men free of charge. Compliments of our partners, the National Health Fund and Guardian Life Limited. And up to 2 o'clock, men were still piling in to get screened. And when they went in and did their screening, none came running out and saying they didn't want to do it again. So it's just a matter of listening and being afraid, but actually having the actual experience, which I think is driving the fear. But we've never seen it. We've never had that experience. Over the years, there are a man who has set himself to go and get his prostate check, run away and said he's not doing it again. We've never seen that.
That's awesome. Let us walk through the numbers. What is the normal number for the PSA? And then you can say that you're in a range which is safe, or it's something that you need to constantly check every 6 months based on the range.
Okay, so there are many factors that contribute to a man having a high PSA level. I mean, simple factors such as him riding a bicycle before he does his PSA test or having sex the night before. Those things will determine what the range is. Several different factors as well, but these will determine what his prostate cancer range is, as well as if he has no disease or middle stage or late stage disease. So it's something that has to be very carefully looked at, yes? Because if a man does his PSA test and the test results indicate that it is way over 10, some people are 100 and odd or so on in terms of range and what it is they are seeing on the blood test, then that gives rise to questions that this person might in fact have early stage or so prostate cancer. And then those below the range are 10 and below, etc. 10, 5 and above, you could say there's something going on there, and then 5 and below could be persons who are not um, indicative of having prostate cancer. But again, these are things that a medical person will be better to explain. But the understanding, or we don't want to get caught up on the PSA results. The simple fact of the matter is, what we want to have happen is that our men understand that you get screened even when there is no symptoms. That's what many cancers, they are there, they show no symptoms. Yes, there's no hesitation to pass urine, there is no stoppage of water in our Jamaican context, hesitance to pass urine, frequent urination at night with nocturnal urine, pain, etc., until it is late. But again, it's a slow growing cancer, so if diagnosed early, right, then the man has a better outcome.
Thank you for that. Mr. Michael, tell me, what were some of the signs, and at what age did you discover that? Not that we're trying to know your age now, but at what age did you discover? Because you mentioned 15 years ago, but at what age, just a range as to you found out, or what prompted you to get checked?
Okay, hi, good evening to the listeners. And first of all, let me compliment Shullian on that outstanding
Yes.
presentation, because I mean, she's been in the program so long and been, hosting seminars over the years that, boy, she sounds like a medical professional. But
Yes.
basically, I had been doing my own checks for a while and had stopped. And I can't tell you a reason why I had stopped at all, because there's no reason under the sun, logically, why I should have. I had no major concerns about doing it. I
Okay.
actually did my first executive profile, which is what we now recommend as the best gift you can give any male in your life over 40 in Jamaica. A gift certificate to get an executive profile. Because what happens then, and I'll get to my story quickly.
Sure.
What happens then is that you create each individual, each human being, as you're all aware, whether you're twins, triplets, whatever, everybody
Correct.
is different. Everyone is different. So by doing a screening at age 40, you create what is your specific baseline measurement using the PSA, which is a blood test, right? I mean,
Yes.
you go just like how they test for sugar and lack of vitamins and all that, and things like that. Okay, so that is the reference point that would be used for all subsequent tests done on you. PSA tests. And then what the medical professionals will do is check against that your baseline measurement to see if there are significant movements. Now, for me, as I said, I did my first executive profile. Maybe I might have done one before, but the one where I became very conscious, it was at age 37,
Mm.
and
Age
everything was
37.
fine. Yeah, everything was fine. As I said, I'd gotten a job, and the people said, okay, fine. It probably was down to two or three candidates that they liked. So they said, everybody, you go and do a full medical, because you don't want to be taking on any risks.
Correct.
Which I think is very responsible for the firm at the time. And went ahead, did it. Was a bit uncomfortable, and I have learned that
Mhm.
um, when you do make references to time in the past, that you should always, I mean, always check to see, what was happening at that time in Jamaica. And you're talking now many, many, many years ago.
Mhm.
And I am, I'm a young man, and I'm looking at doing a prostate test where they had if you think it's bad now, you can imagine what it was then. Yes.
Mm.
Everybody saying, boy, a man can't touch you and blah, blah, blah. Anyway, I went, I did the test, and the readings were fine. continued for quite a while. As I said, that probably was about 1991, somewhere there, or late 90. Um, yeah, it actually was 1989. So I probably was about 35, somewhere there. Yeah. Readings were fine, continued to do it for years. And for some reason, I stopped. And then one day, I saw an associate of mine, and he said to me, Mike, you've been checking on your prostate? I said, why you ask? He say, you haven't answered me. I said, I haven't done it in a long while because I kept going and there was nothing happening, meaning no significant readings and things. He said, well, do me a favor, friend. And I say it against the background that you're my brethren, but
Mm-hmm.
I just did I did a prostatectomy. I said, give me a not so bright and a not so dunce, but just to be sure I understand what you're saying. What did you do? And he told me he had his prostate removed because it's reading. So I said, all right, yeah, a word to the wise is enough. So I then restarted because, as I said at the time, I couldn't think of one good reason why I hadn't been following up. So I restarted, and then in about, so that would have been, as I said, 1989, continued, I would say, for at least another 10, 12, quite a few years. And then, sorry, I had started back, no,
Mm-hmm.
probably about 2008, when I
Okay.
had that discussion with him, right? And, you know, reestablish what my baseline measurements were, and we're going along fine. Uh, and then about late 2008, I think. Don't hold me exactly to it,
Sure.
but I started seeing, having gone to the doctor, he noticed some changes. So I said, all right, Mike, what you're gonna do now is that we're going to move from this once once every year to once
Okay.
every 6 months, right?
Okay.
Because he saw some movements that he didn't like. I said, okay, fine, you're the boss. Um, Started doing that, and
Let me
yeah, go ahead.
interject. What were some of those changes that your doctor
No, sorry,
noticed?
no. The readings were moving upwards.
Higher, getting
Yeah, they're moving
higher.
higher. Sorry.
Okay.
Yeah, the readings were getting higher.
Okay.
So I said, all right, Mike, we're going
Do you
to.
remember the numbers?
No, I can't remember them exactly.
Okay.
But everything is relative to what your baseline measurement is. That's the
Okay.
important thing, you know. So some people will start with what would seem very high for me. I
Yes.
mean, well, as I go on, I'll elaborate a little bit more.
Yes.
Um, and then, so he said, okay, fine. Instead of doing it now once a year, I want you to come in once every 6 months. So
Correct.
the first 6 months after he saw the movement, it went down. So,
Oh,
okay, fine. The important thing, you go back to the same lab, you're going back to the
okay.
same urologist.
Correct.
Um, then it went up the second of the 6 months. So now we're now into 2009. And he says, all right, it's moving, so I want to check. Of course, he would did the DRE. Sorry, Mike. Sorry, he did the DRE once he say he saw that movement, and we'll monitor a little further. When I did the third 6 month, you say, okay, you know what? These readings are much higher than I'd want to see. So
Mm-hmm.
let's do a biopsy. And the
Mm-hmm.
biopsy now is where they, sorry, actually take a sample of the tissue and send it off to a lab for analysis. Yes?
Mm-hmm.
So that's where we are now.
Okay.
And I said, okay, fine. Again, you follow the doctor's instruction. And we have very good doctors locally. Let me say that.
That's
Did that. The tests as Shullian mentioned, the whole thing of doing the digital rectal examination in concert with the PSA reading. Those two are probably the best way. I mean, those two together with the trained medical professional doing the analysis can say, diagnose, yeah, man, there is an issue. The test came back and mine showed that I did have prostate cancer. Not only that did I have it, but I had it. Well, two very important things. One, it was quite aggressive, but even more importantly, it was still within the prostate, which is
What
if you're going to
stage was it?
within the prostate, what you don't want it to do is progress outside
Outside
of the
of it.
prostate, right? When it
Correct.
gets to the stage 3 and 4, that becomes
That's
a major
outside.
problem.
Mhm.
And this is when this this is why we stress early, I mean screening and starting early. Shulian said it, and I'll say that for emphasis, I'll keep repeating
Yes.
it. Get screened Jamaican men once you're 40 years and older. There have been a number of statistics put out and studies. We don't know what causes it, but we
Mhm.
do know Jamaica has among the highest incidence of prostate cancer in the world.
Okay.
It is
Miss
the form. It is the disease that kills most
silently.
in
Um,
Jamaica. I'm not talking about men alone. I'm talking about men and women. The
yes.
urologist will tell you that the biggest problem is the late stage. Only when men are feeling pain or passing blood is when they come, and that's the most difficult. It's almost impossible to treat at that stage.
Thank you so much. Thank you
Mhm.
so much, Mr. Michael. Miss Brown, we mentioned earlier that men who has like a family history of prostate cancer or over 40, what other demographics should men be mindful of?
The key is once you have African descent, you're at great risk.
Okay.
Secondly, if you have a family history, your risk has just doubled. So we can't overemphasize. It is important. The message is clear. Screening and early detection saves lives. Is what I'm
Mhm.
saying. What is very important is that we've been speaking about the PSA, and while that within itself is a good way to test for prostate cancer, we want to look at what a simple thing is. Less than 30 seconds of screening to
Yes,
save your life, which is
that's right.
something that will let you know whether or not you have a disease earlier so that it can be treated.
Mm.
And the other thing is that once you smoke, you're at risk.
Oh,
Alcohol
wow.
consumption also increases that risk.
So the
Diet
lifestyle
high,
overall.
that is correct. So one of
Mm.
the key things is that once you understand that if you are a black man and you've had a family history or no family history at all of prostate cancer, you are at risk.
Do you think that sometimes it's possible that men mistaken, say, prostate cancer with maybe other illnesses?
Well, the key to it is this, when we say screening is when you're at home and you don't feel sick at all, but you still make an appointment to go and see your doctor. It doesn't have to be a urologist, it can be a family doctor or a general practitioner.
Correct.
Right? So it's just it's not waiting until you start feeling sick. So you're
Mm-hmm.
going to mistake the symptoms for something else. You know what I'm saying?
All
And as
right.
I said before, many times there are no symptoms with cancer until it starts to spread, metastasize. It has
Mm-hmm.
not reached to the bone, so your back is killing you. You know what I'm saying? You
That's
have
right.
other issues that you were not previously going through at all. But what we are saying this evening, excuse me, is that one, early detection is the number one way within which to fight prostate cancer. And it's also the number one way to fight any other form of cancer in
Mhm.
terms of getting screened for those cancers that you can be screened for and practicing vigilance. Because not many, you can get cancer from the crown of your head to the sole of your feet and the
So true.
organs within the body as well, right?
So true.
So that
Yes.
is very important for us to be aware of that fact. And then secondly, there's no quick fix. So it's a dedication to practice a screening regimen where you get screened at least once a year, same day, same month. So you can say every birthday, my gift to myself is to get a prostate cancer screening.
That's right. That's right.
The month of December, that's my Christmas gift. February, that's my Valentine's Day gift to myself. But what is important is that you're taking the right decision and the right step.
Awesome. That's awesome. Um, Thank you so much for tuning in to Motivational Mondays. I am your host, Fiona Salmon, and today we're joined by Mr. Michael and Miss Brown, and we're talking about prostate cancer and the to raise awareness about it and to save lives through education, outreach, and to talk about it more. So, Motivational Mondays is sponsored by Ionia Distributors LLC, the company that distributes my stainless steel barware sets, my motivational t shirts, bag, pens. Just go ahead and support me by getting one of my items. And let's get back into the discussion. Mr. Michael, when your doctor told you that um, you had prostate cancer, what was
Mhm.
that feeling like?
What was the feeling like? I don't think I'm one that is inclined to panic.
Mm,
Um, the mere fact that I heard, well, I can tell you, I'm somebody who believes in prayer, right? And I don't mean just in a kind of whimsical way. It's very, very important. And I'm saying, all right, so this is here. I have it. Nothing I can do about having it. I just need to get rid of it. And I can tell you, when the doctor called me and said, Mike, I need for you to come in because we have the test results. And when you come in, bring Winsome. That's my wife. I
mm,
said, okay, fine. So I told her, and we went, met with the doctor. He told me all of what I told you in terms of the results,
yes.
and then outlined the the different treatments, what he would recommend. These are the options based on where they, without doing it in a frightening way, you know, because let me make this point. Not not every time that you do a PSA test, it means you have and the readings are elevated means that you have prostate cancer.
Mm-hmm.
As Shullian said, it could be a number of different things. You could have a urinary tract infection.
Mm-hmm.
Depends on when it was done, the activities that you are involved in before. You could have a number of different things that could elevate the readings temporarily.
Okay.
So it's not something that because you're a high reading means you're going to have a problem, you know, in terms of it being prostate. So, sorry, prostate cancer. So I think as I said, I didn't panic. I told the doctor, and I think he was a little surprised. I said, Doc, here, the family was planning to go away for the summer holidays because I heard in May of 2010. So you have told us the options. Thank you, for your thoroughness and advising me, blah, blah, blah. We had a good relationship.
Okay.
And we'll discuss it and we'll come back to you when we get back from our vacation. So I said, that's okay, because again, you don't want to be doing anything that is in contradiction to what the medical professionals might be recommending. In other words, if you had said to me, "Boy, Mike, I prefer if you do it earlier or something like that," then that's something we'd have to definitely consider, if you understand me. So with that, went off. Um, and when I got back, we we had a chat with the doctor and said, okay, this is the method I prefer to take. Thankfully, I had overseas insurance. We decided um, who would have the discussions with and the course of action. Of course, I called two close friends of mine who had gone through the process not long before. And they were so willing to sit with Winsome and myself, talk about the experiences of whatever they had gone through. And when I say whatever, I mean in terms of the the, the procedures, the options that they had taken. And we had some meaningful discussions, as I said, with these friends. And it means so much. And that is why, I personally have become involved in the whole thing of raising awareness through Brothers United against prostate cancer. Because people do need to have that, people who have gone through the experience before kind of help walk them through, tell them it's not a death sentence. You can,
Correct.
you can deal with it. And
Correct.
I think it's just a responsible thing to do, that we should give back. We should give back, because people are there for us when we have our difficulties. And I think we just should do that. Um, and again, I'm not going to miss an opportunity to say, gentlemen,
Get tested.
get tested. Start
Mhm.
screening early. Ladies, you can influence us. Sometimes you have to take us.
That's
When
right.
you're going for your medicals, say, hobby, come baby, you're not. We're going to, you go to yours, I go to mine.
You
That's
set the
easy.
appointments at the same
Yeah,
time
man.
too.
And let me say this. A lot of the time when the men are in denial, the ladies already know something is not right.
That's right.
Because
That's
it does, you will see the frequency to which they go to bathroom at night.
that's right. That's
You will
right.
see the urgency to pee.
That's right.
You will see in there, you will over time, I mean, you're intimate people, so you will notice difference in his functioning.
Yes.
And of course, again, that varies from person to person, the stage
That's
of
right.
life, the
That's,
physical condition of the male. So there
yes.
are a number of things. But every one of us has a father. Most of us have a brother, a cousin, a nephew, some male member. And as Shullian said, we want people to be more aware of what some of the ailments that are common to your families. It's
Mhm.
very, very important
Um,
that you check and find out, you know. Oh, um, the old man had a problem with A, B, C, or D. Find out if it's stoppage of water. It could be something related. It more than likely is something related to his prostate. It doesn't
mhm.
mean that he has prostate cancer, right? So
Mhm.
that's very, very, very important that we do that.
Yes, thank you so much for
Mhm.
reminding them consistently to go
Yeah,
and get checked.
get
Men,
checked.
if you're listening to this, women, if you're listening to this and you do have males as your partners or your brothers or just friends, encourage them to go and get checked.
Thanks for tuning in to Motivational Mondays with Fionia Salmon. Motivational Mondays airs every first and third Monday at 7 p.m. Eastern or 6 p.m. in Jamaica. And it's sponsored by Ionia Distributors LLC. Follow Fionia Salmon on Facebook, Instagram, and TikTok for info on future episodes and more.